Drutter here, March 12th, 2021, and it is almost day 365 of my lockdown diary. And here in British Columbia, things are getting much better in terms of numbers. Even the cases, which are completely faked, of course, are going down, and the deaths are going down and have been going down for a while. So things are getting much better in terms of the supposed pandemic, which is really just other respiratory infections that have been reclassified since the beginning of 2020. But the lockdown measures are getting worse and worse here, so we're being forced, even in more situations, to wear masks, and even medical exemptions like my wife and I have are not being honored. And so things are just getting worse and worse and worse in terms of civil liberties and our freedoms and how people are feeling, and what they're calling lockdown fatigue in a lot of places. They're getting a lot worse, but the numbers of the virus are getting a lot better. So when the numbers get worse, they say we need to crack down because the numbers are getting worse. And when the numbers are getting better, they say, well, what we're doing is working, so we need to double down our efforts and not stop now and not give up our efforts now. So either way, it's always about tightening control and giving up the people's freedoms in return for supposed safety from this supposed pandemic. But I didn't really want to talk too much about that today. As you can tell by the title of the video, I have a story about being forced to take a vaccine, and it wasn't a force by, violent force, people surrounding me and jumping on me and injecting me, although I do have stories about that from the other side of the needle. Because I was a nurse, and as a nurse I was forced to take vaccinations and injections, and I also was responsible for forcing other people to take vaccines and injections. So when you say it that way, it sounds like nursing really is kind of a violent or coercive occupation, and I guess it kind of was. I did see a lot of blood, a lot of death, and a lot of it was because of me and the people that I was working with. We were responsible for suffering, and that's a problem with the healthcare system. It always has been. It's not really about do no harm first. We choose to do some harm here and there now, and we ignore that do no harm mantra that medicine has always had. But that also I did not really want to talk too much about. When I was forced to take the vaccine, it was 2006. And I was working as a registered psychiatric nurse in psychiatric acute care. I was working in a setting with adults that had acute mental illness, and I was also working in another setting with elderly adults, and that's called extended care, or at least it is around here. It's called extended care, or basically people who are living in facilities as they are on the way out. And so I was dealing with mentally ill adults, and I was dealing with elderly adults that were basically end of life. So I have cared for a range of people, basically everybody except for children, and I've had 3 children myself, so I have some experience with children's respiratory illnesses and dealing with those as well. And but when I was forced to take the vaccine, it was 2006. As you may know, this channel started about that time. That was before really I had woken up. I wasn't anything what you would consider anti-vax, and I don't even think anybody back then even was considered anti-vaccine. It wasn't really that large of an issue, and it hadn't really been politicized and pressed into our minds the way it has now. But and vaccines back then were bad, but they weren't as bad. I think my opinion is that vaccines generations ago started off not quite so bad and a lot better with, and they had some effect, and they had some positive effects. I think that has changed over the generations, over the decades, and I think that now a lot of Western medicine, allopathic medicine, has been corrupted, and vaccines are definitely one of those things that have been corrupted. And I do not take vaccines. I don't believe in vaccines anymore, but this is not about that either, really. I want to talk about this story, and I am getting to the story after the setup, of being forced to take the vaccine. And like I said, it was a force of coercion. One day, I was actually out of the unit, and I think maybe looking back in hindsight, that's why I was approached there, because I was out in public and not technically on duty. I think I was on a break at the vending machine, I think I was. And my manager, my nursing supervisor, unit supervisor, approached me, and she said, "Have you had the vaccine yet?" And I think she already knew that I hadn't, and I said no. And she said, "Well, you're now the only one who hasn't." And this was the days of H5N1. Do you remember that one? that was considered an avian flu. But these viruses don't know anything about where they are. They're not shaped like chickens or anything like that. We have this strange idea that chickens are sneezing and the snot went on to somebody. That's not how it works, but we give these names. The avian flu. The avian flu was supposedly going around, and all staff was supposed to take it at the hospital that I was working at. And I was one of those people that was I had always not really been interested in taking medication unless I really need to. And I felt that this was a prophylactic thing, this was a preventative thing, and that I would not need it because I had a strong immune system, and every other time I'd ever gotten any kind of infection, I'd always beaten it. And I thought that I would with this too. And so it had been going around the hospital for months by this point. There was no talk of masks. No one had ever worn a mask back then, not even in hospitals. We did not wear masks in 2006, ever. You would have to be in surgery to wear a mask. And it wasn't circulating. It wasn't going around. We didn't have, not even an extended care where I was working, where people basically died from anything. That's how old people basically die, is through respiratory infections. Not a lot of people know that, but that is, other than cancer and heart attacks, that is really one of the ways that people go, is their lungs get gunked up and they die. And I think pneumonia was called the old man's friend, I think, back in the day, because it just was a mercy killer. It just came along when you were basically bedridden and almost dead and you couldn't really move, and that's kind of why it takes hold, because you can't get up and exercise. And yeah, people just die en masse of pneumonia and pneumonia, basically all that means is you've died of a chest infection. That's all pneumonia is. It means an infection in your lungs. So yes, we've been dying of lung infections, bacterial and viral, for a long, long time. As far as I'm aware, we have been dying for generations of these things. And we have been fighting them off. And that's what I said to my boss. I said, I'm pretty sure I'll fight it off. And she said she wasn't going to take it this time. I think that's what I had said the last time. And she said, you really do need to take it. And I said, do I have to? And this is, of course, back before I had woken up, before I had studied any of this, knew about civil liberties, anything like that, or even really believed in standing up for myself. I was working for the man. I was a sheep, essentially, just with the glimmer of hope in me. But at that time, I hadn't really gone into it. I was married. I felt that like I had to go with the system on this. And I think that's where a lot of people are now too. And I'm telling you, you do not have to. You do not have to. And because you are considering, and because maybe you will do that, and the more people that do that, that is why it becomes mandatory, and it becomes essentially mandatory, de facto mandatory. It's because so many people go along with it. But if you are not comfortable going along with it, please don't. And I've done tons and tons of content. I'll put a bit down below for you to link to if you're worried about the dangers of this. Is it safe? Is it effective? I have lots of information about that, and you can check that out. But my boss basically came at me and pushed and pushed and pushed, and eventually there was nothing in me. There was no spirit. There was no fight. I didn't have the words to say what I wanted or what I meant to say, and I just said, I guess if I have to, I have to. But she never did say, yes, you do have to, or you will be fired. She never said those words. And I should have maybe made her say those words. I don't even know if she would have. Maybe I could have gotten away with not getting that vaccine and still working. But what happened after I got the vaccine was I got the first illness that I had had in years. I was sick for the first time, and I was very sick. And I thought nothing of it. I thought it was a coincidence. And it only was months later, that people were telling me, man, I got sick from that. I said, wait a second, I guess I got sick from that, because it wasn't going around my unit. My family wasn't sick. Nobody I knew was sick. And I hadn't been sick for years, even though I've been working with sick people. Suddenly I got the vaccine, and I was sick. That is the last vaccine I've had. That is the last vaccine I've had. And it may be the last vaccine I ever have. And I'm not taking this COVID vaccine, that's for damn sure. But I just wanted to share with you how it felt to be coerced, to be told almost that you had to take it, almost that you would be forced to take it. And I felt like I wanted to avoid that being forced. I wanted to take it before it hit that point of, now you have to. Now we're gonna, I didn't know what that meant. I didn't know if there would be people coming to hold me down, or if I would just be told you're losing your job or what. But I was afraid that that would escalate to that point. And they used that fear to make me roll up my sleeve and take it. They told me everything else under the sun. It's free, it's safe and effective, all that kind of stuff. That was another rushed vaccine. And people got hurt by that. And now I want to shift a little bit, talk about from the other side of things, because as a nurse, especially working in psychiatry, but also working in extended care, there were violent patients. There was situations where we had to call a code white, for example, which meant anyone in the hospital who's available and who's able-bodied come and jump on the patient, basically. And so if you are in a place that is going to have truly forced vaccinations, and I think every place is in some manner, even in Canada, I think there will be some situations where people do have to take it. For example, if they are in psychiatry and if they have been certified by a doctor that says they have to stay there for their own good. In that case, those patients are given injections, including vaccinations, that they don't want. And I have given many injections to patients that did not want it, and it has haunted me, and I'm not going to go into that part of it, but it's one of the reasons why I left nursing, is because I felt like I was, the man. I became my own enemy. As I woke up and realized what the system is all about, and especially how big pharma and psychiatry can be used against people, I really read and learned about the Mental Health Act of BC, and it started to scare me how much power we had with the signature to get people locked up, especially for just going against the status quo. I recognized that and didn't want to be part of it anymore. And I'm happy that I got out of nursing after 10 years. Walked away from my career. I had a lot of money, I had a lot of prestige in the community, and I said none of that's worth it. I walked away from that, and I have not been back. They even invited me at the beginning of the pandemic, any ex-nurses, any retired nurses, any nurses that just got their licenses yanked, whatever, doesn't matter, we'll take you. Boy Scouts, line up, you can give vaccinations and get paid for it. Hell no. Hell no. So, no, I won't take the vaccine. No, I won't give the vaccine. But I did force people to take vaccines and other injections of antipsychotics and other sedatives and so forth that doctors decided had to be forced into patients. And if you are ever in that situation, here's what it may feel like. You will hear over the announcement, if you're in a facility, you'll hear an announcement for help, such as a code white or an emergency, and you'll hear the unit that you're on mentioned. So if it's like D5, you'll hear code white on D5, or violent patient on D5, something like that, emergency on D5, wherever you are. That is the first indication. Then the nurses and other care, team members will have a meeting, usually apart from you, away from you, so that you don't know what's coming next. They'll maybe in the nursing station behind a closed door or something, but they'll decide a plan of action. Then they will approach you, and they will try and approach you when you are away from other patients or away from other inmates or wherever you happen to be. And it will be at least 4 people, sometimes as many as 10, depending on who you are and your history. And they will give you one last chance to take it peacefully. This is how it is always done. The patient is given a show of force, it's called. The nurses, the aides, whoever, doctors, anyone who's handy will come, a show of force, and they'll say, we're about to basically beat the crap out of you so that you take this. If you don't take it willingly right now, gently, and very calmly allow us to give this. Otherwise, it's going to be a mess. Will you take it? And that's up to you. I'm not going to tell you what to do at that point. Because if you don't take it, you will take it. That is for sure. There is no way that you, at that point, cannot take what is in that needle. And I'm sorry to say that, but when you see that needle, that means that you are getting what's in it. And that's pretty scary for a lot of people, especially on psychiatry. I had some very psychotic patients that believed the government was out to get them, and that the government might come and inject them with something as part of that plan. And then when you show up with a syringe and tell them they have to take it, otherwise you're going to force them to take it, you see the panic in their eyes. And I don't like that memory at all. And I don't like that there's going to be people in that situation now that are going to be forced to take this COVID vaccine. And Some of them will be on psychiatry, but some of them will just be elderly patients who are forced to take it in care homes. The doctor will write an order. Patient has to take it, and that has to be done. That will be done. The doctors will be done. And it is done by violence if it is necessary. And sometimes patients get injured or even die in the process of these injections, forced injections being given. And that is a sad reality. We don't believe in do no harm first. We've scrapped that, and that was a very important part of medicine. And the next thing that will happen is if you say no, or you don't, if you don't immediately lie down, roll up your sleeve, whatever it takes to make that injection go into you peacefully and quickly, they will give a signal. There will be a signal, a word will be given. The head nurse, you will find someone will be giving the instructions to you. That person will be kind of in charge, and that person will give a signal. They might say elephant, for example. It might be a word that you, like, what? Why did you say that? That is the signal for you to be attacked physically. And there will be one person that comes at you for each limb. If you're a man, you'll have 2 on each limb. And this is just standard protocol for how to do a takedown. And it's called non-violent crisis intervention. And I didn't realize until later how Orwellian that is, because it is a very violent crisis intervention. They call it a non-violent crisis intervention. They just put the word non in front to change it around, but it is a violent crisis intervention because the patient is attacked physically, grabbed, held, pushed, shoved, and sometimes even squatted, kneeled on. They can breathe sometimes, and when I watch those videos of cops kneeling on people, it makes me shake my head because I realize, how quickly you can kill somebody that way, and the cops must know that too. Because we sure knew that in medicine. And if they're not at least trained that if you squat on someone's chest like that and put all your weight on there, that can kill them, then something is wrong, horribly wrong with that training system. But we already know that. But the cops hopefully won't be involved in your takedown, although they can be called. If you will not be tamed by these 8 people on your limbs and one person coming up with the injection, then they will call the cops. They literally will phone the cops. I have called the cops on patients I am ashamed to say that we could not handle, and the cops came and they were worse than us by tenfold. I saw patients get taken down by tasers that hit face first, hit pavement because they'd been tased on their feet. Stuff like that, flesh ripped out by these taser barbs, and cops just pummeling people with batons and fists and knees and boots. Because they wouldn't take a pill, they wouldn't take a shot. And I really hope that it doesn't come to that for this COVID shot, but in some places of the world it will, and even in Canada in some situations it will. So if you find yourself being forced to take that injection, remember, when they show up, it is too late. It is too late for that. And you can say things, and I recommend you do say things like, I don't consent to that. I don't want that, and I don't consent to that. You don't have my consent. Say it in as many different ways as you can, because that's reaching people. You're reaching they're humans. And they remember that, and they will actually write that down in the chart. They'll say, when we approached the patient to give the injection, they said, I do not consent to that. And that they legally have to write that. So it is maybe a good idea for you to say as much as you can. But do it clearly. Don't get too frantic. Don't get violent with these people, because they'll get violent back. It's just like cops. And they don't have guns, but they will call the guns if they need to. So don't escalate with nurses once it gets to that point. Try not to let it get to that point. Don't get yourself certified. Don't get yourself in jail. Don't get yourself into a care facility if you're an old person, if you can at all help it. Because these are such situations in which people will be forced to take it, even if they resist, even if they say, I don't consent. And so I hope that gives you a little bit of an idea of what to expect if that is your situation. I really hope it is not anyone's situation, because we've been told this is not mandatory in Canada. Of course, it is de facto mandatory. You are not part of society if you don't take it, and eventually, of course, they will come and get us. But for now, it is officially non-mandatory, so this hopefully will not be very many people's experience. Thanks for listening, and talk to you soon.